Hello everyone, I'm Dr. Devayani Barve, a cosmetic and reconstructive surgeon. In my practice, I often see children with injuries, whether it is burns, finger trauma, cuts to the face or hands or other parts of the body. These accidents can be very distressing for both the child and the parents. But with the right surgical care, children heal remarkably well, both in appearance and function. Today, I'll take you through how we approach these injuries in the operation theatre and what happens behind the scenes to ensure your child's best recovery. When a child comes in with a burn, whether it is from hot liquids, from exposure to an electric current, or an accident, our first step is to assess the depth and the area of the burn. There are some formula which help us with that. Superficial burns often heal on their own with regular dressing and scar care. But for deeper burns, we may need to plan an early surgical intervention. In the operation theatre, we remove this dead tissue and cover it with healthy skin from the other areas of the body. The goal is to help the skin heal smoothly, prevent any tightness, and minimize the scarring. In later stages, we may use lasers or scar revision or other techniques to soften the scar and match the skin tone. The best part is children's skin heals beautifully, and with modern cosmetic surgery techniques, we can make the scars barely noticeable over time. Now, another common emergency which we handle is finger or hand or toe injury. This can be from playing outdoor sports, from coming in between a closing door, or sometimes even during playing at home. These injuries can involve crushed fingertips, nail bed loss, or even partial amputations. In surgery, we perform microsurgical repair, which means working under a high-powered microscope to connect tiny blood vessels, nerves, and tissues. If a fingertip is lost, we can often reconstruct it using local flaps or skin grafts from the patient's own body, restoring both the look and the touch sensation. The aim is not just to save the finger, but make sure it looks natural, grows properly, and functions normally. We also guide the parents on hand therapy and scar care because rehabilitation is an important part of the complete recovery. Cuts on the face, lips, near the eyes need special attention because even small scars can affect expression and confidence as children grow. In these cases, we repair the wound in layers, aligning the muscles, skin, and the edges precisely under magnification. We also use fine absorbable sutures and sometimes surgical glue, especially for visible areas to prevent any marks. The goal is a seamless blend with natural skin lines and contours. After healing, we guide parents with how to take care of the scar after surgery, using sunscreen, silicone gels, gentle massage as required. If needed as the child grows up, some small laser sessions can also be done to improve the result. In our team, we focus on comfort, safety, and aesthetics. Children and their parents are often very scared when it comes to anesthesia, but it is the safest way to go. And we have a pediatric anesthetist present at all times. We plan each case individually, so no two injuries are the same, and our goal is to always restore form and function together. We keep the parents informed at every step, showing them before and after progress, explaining how scars evolve, and ensuring follow-ups for long-term results. It is one of the most rewarding parts of our work, watching a child regain confidence, use their hand freely, and smile and play again. So whether it's a burn, a finger injury, or a facial cut, early expert treatment truly makes all the difference. Cosmetic and reconstructive surgery isn't just about the appearance. It's about restoring a child's comfort, confidence, and normal life. If your child ever faces an injury, seek care early, as the results can be life-changing. And remember, you may be anxious, you may be scared about how it's going to happen, but don't be scared of anesthesia and don't be scared of approaching the right expert, because that is what will make all the difference. Thank you.